Dr. Olitsky is an ophthalmologist, board member of the International HHT Foundation. I'll remind everyone that that stands for Hereditary Hemorrhagic Telangiectasia, and this is a condition that most commonly, I guess, can cause frequent and severe nosebleeds, and that is often what brings patients to the attention of doctors, but not always. So before we get started again, I have a question for you, Dr. Olitsky. How did an ophthalmologist get involved with HHT?
That's a good. I'm often asked that because I certainly don't treat directly patients with HHT, but I'm part of a family with at least a 5-generation history of HHT, so I've seen firsthand some
personal history.
Yes.
Wow.
So I've seen firsthand some of the devastating effects, and sitting on the board now for several years, I've heard some of the really very tragic stories, and really the most tragic are the phone calls that we get, unfortunately not infrequently, about a young child who has had a major stroke or even died when the diagnosis would have seemed fairly obvious to some of us, or maybe more tragically, a family that has a history of HHT but didn't know to get their child tested or screened.
Right. Okay. I understand that then. Pamela from Michigan has a question. Are you there, Pamela?
Yes, I am.
Okay, go ahead.
Hi, Dr. Olitsky.
Good morning.
Good morning. I'm sorry to hear. I'm aware that your father has it, and I've been talking a lot with your mother on Facebook. My question is, although my family has this, and I've tragically lost my mother and lots of family members due to this disease, and I can relate with the nosebleeds and the transfusions and all. My question is, I do have a son. He's 22. He's not really had any of the nosebleeds, and he's not showing any of the telangiectasias on the lips or the tongue like the rest of my family has had, as well as myself. But that doesn't necessarily mean he doesn't have the gene. What I need to know is, what test would I have to ask the doctor to perform, or the name of it, to have done on him to find out whether he is carrying the gene or not?
Okay, that's an excellent question, and I think a very important one. So first of all, if you have a family member such as yourself with known disease, one way to do this is to have yourself genetically tested. So a patient with known disease can have a test done. Right now, about 50% of those patients, they will find an actual mutation, an identifiable mutation. So for half the patients, the question's fairly easy. Get yourself blood tested. And then if they can find the gene, which they can in about 50% of the patients, they can then test anybody else in your family, any other relative that's linked to you or to somebody with the disease. And if they do not have the gene, if it's not detected, that person does not have HHT, and no further testing is needed. Their children don't need to be tested. Those patients are free of the disease. For the other 50%, where the gene cannot be identified at the present time, and with time more genes will be available to be found, or if it is unknown for certain that a family member has it, then there are several screening tests that need to be performed. And as you may know, the two life-threatening conditions that we worry about with this disease are lung or pulmonary AVMs, which allow for an abnormal bypass of the normal blood circulation by bypassing the lungs, which can allow blood clots or bacteria to go to the brain and cause a stroke or brain infection, or abnormal blood vessels in the brain, which can lead to stroke or sudden death. These two things can be screened for. One, the brain can be screened with an MRI scan looking for those abnormal blood vessels. Looking for the abnormal blood vessels in the lungs requires something called a bubble echo test, where an echocardiogram is done, an ultrasound of the heart, and essentially saline or water with some bubbles is injected into the vein, and the cardiologist can look to see if those bubbles bypass the normal circulation of the lungs and heart. So those are two relatively simple tests, and it is recommended that anybody who is at risk for the disease, meaning they have a parent who may not be able to be genetically tested, should have
Okay, Pamela, does that answer your question?
Yes, it does, because he does definitely need to be screened. Although he's not showing signs, doesn't mean he doesn't have it.
And again, as we mentioned, 10% of people with HHT will not have a nosebleed. So the lack of nosebleeds is not an indication as to whether or not you have the disease. So now, for you, if they can find the genetic defect on testing, then he just needs a simple test. They can take just a little smear of from inside his cheek, and it's that simple to test him. If they can find first they have to isolate the gene in you, which there's about a 50% chance of doing.
Right. Well, I'm experiencing. I'm getting the port put in, and iron infusion, blood transfusion dependent. My nose has been lasered. There's nothing left, and now I'm facing the Avastin, which I'm looking forward to. And listening to you has been so much helpful. In fact, it's kind of tearful. But I do appreciate you coming on, and your mother giving me the access to the Sirius radio to be able to listen to you today, and I appreciate your time and your knowledge.
Well, thank you very much for calling, and I think it is a very hopeful time. There are a lot of new